So now that we've explained to you what an aneurysmal subarachnoid hemorrhage is, what it looks like, the clinical manifestations associated with it, and the different types of treatment, we're going to take a couple minutes to answer that "so what" question. As nurses, how will this life-threatening medical condition affect the way we do our jobs? What do we need to know as nurses to best evaluate and treat this condition, as well as care for the patient in the best way possible? We've learned that a subarachnoid hemorrhage is an extremely dangerous form of a stroke that is often misdiagnosed. As nurses, we need to be able to recognize and understand the clinical components and severity of the situation we are dealing with. By recognizing those clinical components, we are then able to intervene for early treatment and possibly prevent secondary complications. Nurses are an integral part of the healthcare team and have certain diagnostic and treatment goals when dealing with SAH patients. These include, but are not limited to, early recognition, accurate diagnosis, stabilization of the aneurysm, prevention of complications, treatment, and rehabilitation. While each member of the healthcare team has a specific role, everyone must be properly educated about the condition their patient has. For example, the nurse will not be the person responsible for clipping the aneurysm. However, they must understand what the procedure entails and how to offer efficient care to the patient pre-op and post-op. By understanding the entirety of the condition from start to finish, the nurse will be able to offer the patient more effective care and hopefully lead to a successful outcome. It is important that nurses understand that the two most common surgical treatment plans for SAH patients are either clipping the aneurysm via a craniotomy or coiling. This is an endovascular procedure. Complications that SAH patients may experience include cerebral vasospasms, hydrocephalus, hyponatremia, loss of short-term memory, behavior changes, seizures, and dysplasia. This list is not exhaustive. SAH patients typically spend anywhere from 10 to 16 days in the ICU after their surgical procedure, and another 5 to 7 days in a step-down unit before discharge. Nurses are responsible for two types of care: pre-aneurysm care and post-aneurysm care. Pre-aneurysm care may include blood pressure management, oxygenation, intracranial pressure monitoring, or ICP, and intravenous fluids, just to name a few. For SAH patients admitted to the ICU, post-aneurysm care for the patient will also include BP management, ICP monitoring, fluid and medication administration, as well as fever management. It is important to note that for the brain, the road to recovery can take anywhere from 6 to 15 months. And last but certainly not least is the nurse's role in patient and family education. Patients who have experienced a subarachnoid hemorrhage, as well as their family, are often overwhelmed with the amount of information given to them. Due to the severity of the condition, it is crucial that the patient and their family or caregiver be properly educated. This includes what to expect during the road to recovery, as well as the signs and symptoms of another possible stroke. They are also educated on the certain imaging tests that may be recommended to blood relatives of the patient as well.